Hello, this is Dr. Gay from First Look MRI, and this is a 48-year-old male who complains of ankle pain and swelling and weakness for several weeks. On the MRI here we have a sagittal view looking in profile where we see his calcaneus back here, the heel bone. We see the Achilles tendon coming down here looking normal, plantar fascia down here looking normal. And on this view we see the tibia. We're looking straight on. This is a coronal view. We see the talus underneath. The talus looks flat on this view. On this view it looks rounded. This is the talar dome. This is the same area though. And we see no osteochondral defect, no OCD of the talar dome. That looks good. There's a marker above here, and there's some edema in the soft tissues here where the skin marker is. But the main finding is down below, distal to that marker. This is the patient's talus. This is their calcaneus. And we have this abnormal joint here. This is the middle subtalar joint. And the middle subtalar joint is broad, and there's some spurring, there's articular irregularity, and this is what we call a coalition, a cartilaginous coalition. If the bone was bridged right together, a solid block of bone, we call it an osseous coalition. Or if there was a thin band of fibrous tissue, we call it a fibrous coalition. But in this case, there's gray intermediate signal, there's gray material here. We call that cartilage. We call this a cartilaginous coalition. And these patients can have reactive marrow edema, and this is what they do have. This is a fat-suppressed sequence, so anything bright is abnormal. There's a little bit of brightness here, so reactive marrow edema. Typically, these cartilaginous coalitions will have reactive marrow edema just like this, and pain. Again, the joint is broadened with articular surface irregularity on a developmental basis, and they get ankle pain and instability. In this patient, this tendon, the posterior tibial tendon, goes right past that. If we look above the joint, there's fluid right here in the tendon sheath. It's distended, so it looks like this patient has some tenosynovitis, or irritation of that tendon as it goes past that coalition. And the fluid is built up here, and there's subcutaneous edema. This is all in the subcutaneous soft tissues above the ankle joint. And so the pain, even though this coalition is down here, the pain is up above that, and it looks like it's related to this inflamed tendon sheath and the inflammation in the soft tissues up here. But this is an example of a talocalcaneal coalition. Let me put up a sagittal view to show where it is. It's right here on the sagittal view. We have an anterior subtalar joint, or the talonavicular joint, right here. We have a middle subtalar joint, which is right here. This is the abnormal joint. And we have a posterior subtalar joint here that looks normal. Patient also had a little ganglion cyst back here as another incidental finding. And that's it.